This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, we are excited to announce that we are now accepting applications for our second annual Diversity and Inclusion Award. The award is eligible to fourth-year med students identifying as underrepresented in medicine and are applying to EM residencies. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, with winners being announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application. Or you can click on the link in our show notes. Thank you.
All right, good morning, Medical Minute people. All right, does anyone ever have the experience like I do where EMS drops someone off and they're giving a report about something like an ankle fracture and then they say, and we checked the lactate and it was 5.6. And your first thought is, why did you check the lactate? Okay, so this study is actually pretty interesting. It's about kind of indiscriminate checking of lactate and what happens if we just check lactate on everyone. So this was called Prevalence and Clinical Significance of Point-of-Care Lactate, Elevated Lactate at Emergency Admission in Older Patients, a prospective study. Okay, so the basic idea is there's one emergency department in Sweden where they hired a nurse researcher during business hours only to draw lactate on just everyone who presented to triage that met the only criteria they had to have was age over 65. So if you're over 65, everybody got a lactate. And this was a point-of-care lactate, and the only people that were excluded was if you were coming in for seizure, because we know seizure can elevate lactate. So this was in 2019 and 2020, and let's see, they got 602 patients. Oh, and what they were looking at was how many of these patients are actually sick. And so they defined sick as needing lots of IV fluids, getting admitted to the ICU, dying, getting intubated, or needing pressors. So that's a pretty good like definition of who's sick. So what do you think the results were on how they did with lactate? So how many, if you just screened all 65-year-olds, how many are going to have an elevated lactate? 75%. That's high. That would be good. It was actually around 27%. But of those patients, there were only 7.3% that were actually sick. So notably, there were a ton of patients that had an elevated lactate, but they weren't in fact sick. So number one, you should just know that if you're in Sweden and you're drawing lactates on old people, a quarter of them are going to have an elevated lactate. And that probably applies to our population as well to some degree. And then number two, a lot of people with elevated lactate are not going to be sick. So it suggests that our policy should not be to widely grab a lactate on everyone, but to be really specific like we are, and mostly patients that have surge criteria. So bonus question, what are some other things that can elevate your lactate besides, so we already said seizure is one thing, sepsis, of course. Other things that can elevate your lactate? Exercise, yes. If like a 65-year-old just sprints from the end of a marathon right into triage, they're going to have an elevated lactate. So there are actually a lot of medications, some of which we use commonly, which can elevate your lactate. So probably the big two that we use commonly are albuterol can elevate your lactate. So if kind of late in the game we've been giving somebody nebs for hours and they're like, well, let's check a lactate, you can guarantee there's a good chance it'll be high. Metformin, patients who take metformin often have lactic acidosis. And then there's some less common ones like linezolid, IV epinephrine, patients that are on some of the antiretroviral medications if they have HIV. So just kind of take-home message, lactate is awesome when used in the right setting. Don't just draw it on everyone like ankle fractures that get dropped off from EMS. And particularly in the older population, there may just be kind of spurious elevations of lactate that don't correlate with any clinical badness. That's it. All right. Thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.